some people have actually done attachments in different areas. So for example, medicine and pediatrics are notoriously hard, and some people have attached themselves to the department so then they could actually have some sort of exposure to the Hong Kong world of pediatrics or medicine. So that could be quite helpful for some people. I personally didn't do it because I was actually working as a full-time doctor in the UK when I was preparing for both the writtens and the clinical exam, but I was working in A&E, so that was actually very useful as well. So I know that taking half a year out or a year out might not be feasible for everybody in the room here, but actually just use what you can do in your local hospitals. So when I was in A&E, I really took the time to listen to someone's heart, or, you know, if afterwards you realize that they have a murmur per se, just go and listen again. And even for pediatrics, because I was also working in pediatrics A&E, I managed to spot some syndromes, and just seeing how they proceed with things really helped as well. In terms of cases and things, we've got this red book thing that we quite like as well. That's by the Hong Kong U professor. We can talk more about that later on, but you know, just go through some cases. That's probably quite useful as well. There are loads of resources on different cases, and just take yourself through the case scenarios. And I echo what Raymond said as well. It's useful to know some local terms as well. So if you're taking the clinical exam, you know, you can take in English, but little things like raising your hand up or sticking your tongue out, that could really help as well when you're taking it, because at least, if anything, you know, it's not all about the accent. At least it shows that you're trying to engage with the local community, and that's very important because, you know, 90% of your patients will be Hong Kong Chinese. So yeah.
Okay. What about you, Marcus? How did you prepare for the clinical exam?
So it's very different from the written. In a lot of ways, it's harder. You're asked to perform. So back to the U.S. background, that's a little bit different. You don't really see that as much in the U.S. So I think that, you know, with the attendees, for example, from Australia and the UK, it'll be very familiar for you guys to how to approach those kind of examinations. But very importantly, you should really have a study group for the clinical. And sometimes that's overstated. What does it mean to have a study group? What I mean by that is really only about 20% or maybe 25% of your time is spent with the group. So you're still very much studying on your own, practicing what you've gone over with the group. But the group is very important because of that performance angle where you are asked to speak. So the last thing you want to do is hide away in some library or the back of a coffee shop and no one will see you for a few months for the clinical exam, because you won't have rehearsed how to talk to people, whether it's an examiner person or whether it's the patient person. But either way, you need to be speaking to people and getting used to that. So that's very important. I'd like to reiterate also what Grace said, that, you know, you need to know some terms. So especially for the overseas folks, maybe they're not routinely seeing patients in Chinese at this time. And so to really learn some key phrases, it's a timed exam, so it'll save time on the clinical to know something, but that's also really important as well.
For clinical exams, I also used some guidebook from the membership level, particularly for the MLCP and CPCH. Of course, is the system for the Hong Kong physician training also come along with the MLCP as well. So what they're looking for, the way you present on like certain disease, what sort of clinical examination you should be able to demonstrate in your exam or record in most like famous textbook like Oxford or other different types of membership level textbook. For the surgery, I do agree with Marcus, that's a little bit different from the usual, and that still membership level, the MLCS textbook would able to help you to aim what you should be performing. If you get a chance, you should also like learn some local way to present in the surgical exam. I mean, there's a little bit different from what I learned from Australia. It took me some time to adjust myself on how to perform that. Even myself as a surgery service resident, it made a little bit different on how we present or what we should examine in the Hong Kong local way. So do take a word. For ONG exam, that part is mainly paper questions with three life stations generally. And so knowledge base is still the mainstream for the ONG. So I do recommend by the time when you prepare for your clinical exam, do pay more attention on the medicine and the pediatrics. They are all the most challenging station for you to get the pass.
Following up Marcus's point that you really need to interact with people instead of, isolating yourself whilst preparing for the clinical exam. I know that Grace, you actually prepared for the exam in the UK instead of in Hong Kong. How did that affect your preparation for the practical exam?
I was working in A&E back then, so that was really useful, seeing all the patients with all the exposure as well. But, bearing in mind that this is actually quite a long exam as well, in the sense that you are required to be at different hospitals over the span of maybe 2 weeks or 3 weeks. So you have to think very cautiously about your leave as well. So make sure that you give yourself enough time to interact with the patients, to it's difficult doing it abroad, preparing abroad, but what you really need to do is to make sure that you get to Hong Kong in time for it. And obviously now with COVID and all of that, you need to take into the consideration of quarantining for 2 weeks as well. So I would say, yes, I totally agree with the study group thing that Marcus has said as well. And, even if you can't do it in Hong Kong, you can do it over Zoom, like we are doing it right now. And, you might be able to gather some friends in Australia or in the UK as well to just go through things as well in face-to-face at some point, even when you're abroad. So I would say it's quite useful to have a network. And what I found certainly useful was having the Licentiate Society as, a unit for us to have everyone together. And, in these societies, sometimes we're like, oh, is anyone in the UK preparing for the exam? Can we have a study group? It kind of gives you sort of resources and people, resources being people who have gone through the exam. To sort of take you sort of step by step, just, talking about things. So, I would say that yes, study group, yes, making use of your local resources, and also actually getting to know some of the terms, as we've said, and also trying to talk to the local graduates as well to see what sort of things, what sort of common flavors, common topics that come up in their exams, because obviously majority of the time you'll be having examiners from either Hong Kong U or the Chinese University of Hong Kong. So seeing what they prefer actually helps as well.
So when you fill out the application for the exam, with the medical council, the application asks if the patient speaks in a certain language, what language would you need an interpreter for? And so I indicated that I would like that. I appreciated that opportunity because it really makes the exam more accessible for the global world, for the international folks. And I did learn Cantonese some. I had already been, interesting to know, I had already been like working under limited registration 6 years at Hong Kong U and Queen Mary prior to that. So that really helped to learn the language. I'm certainly not fluent, but I knew a few terms here and there. And it's really important for the exam to try, because it is timed. So the more time you can save, that's really important, first of all. Secondly, Grace alluded to this earlier, you want to demonstrate that you're motivated and interested in the Hong Kong system. So knowing Cantonese is really important so that you can connect with your patient. Fundamentally, we're all doctors. So if you can ask the patient, are they in pain? Or if this hurts, if while you're examining the patient, you let me know, this kind of phrasing, or even a simple introduction. I remember one of the earliest things, forgive me if I pronounce this incorrectly, but and then I would say this to start in the exam. But you know what? I ended up using it all throughout the internship as a polite way and verbal consent to get started admitting that patient in that 36-hour on-call or whenever. So a lot's been said about the licentiate exam, but I really think there is some logic to it in preparing you for what you need to know to get you into that 36-hour on-call, to get through that experience. A lot of the factors that are featured in the exam, believe it or not, I don't think it's really discussed often enough, is that there is a certain sense that it helps you get through the next stage afterwards.
What about you, Raymond? What do you think? Would you
Well,
recommend using an interpreter?
yeah, well, as a person who grew in Hong Kong and studied medicine in Australia, like my mother tongue should be Cantonese, but I did meet difficulties on getting history in Cantonese when I was in the exam at the very beginning. Um, I did attempt all my exams in Cantonese, but I also request interpreter for me, and because we've been trained in English, talking English for almost like at least 6, 7 years in Australia. Um, your brain is trained to think everything in English. So by that time, when I was in exam, sometimes I really couldn't thought, okay, what my question would be in Cantonese, or what the patients would reply means in English. So I also get my interpreter, not very often, but only like a few questions, that one or two, that what would that be in Cantonese, or what he or she said before, can you translate for me in English? That would be really helpful. But like what Max said, as we are working in the Hong Kong system, we should tailor make ourselves in a way that we can fit into the system. We talk in Cantonese most of the time at work, like with your colleagues, with nurses, doctors, patients. So if you're really keen to come back to learn Cantonese well before, even you can just simply talk to your parents to prepare for history taking. But I wouldn't say getting an interpreter will really mark you down for your exam performance. It may sometimes help you to understand the jargons the patient explained what they taught to you in the clinical exam setting. So it's all right, but if you want to perform better, it would be easier to speak Cantonese to make everything smooth.
Okay, so definitely Cantonese is very important. And now we will move on to the live Q&A session. Number one, is there any preparation courses available for a clinical exam?
That's one of the missions of our group, has been to provide clarity and leadership and guidance in this area. Now, apart from that, if you want to go like take it to the next level, I know that some people, they sign up to do like the exams in the UK to, to go ahead and get the MRCP, for example, the qualification. It is quotable in Hong Kong anyways. So if you have an interest in medicine or MRCP-CH for pediatrics, for example, those would probably be an invaluable resource for your exam, and also quotable. I know that I was lucky enough to pass both parts on the first try, but my backup plan, if that didn't work out, was I was going to go ahead and sign up. I had my calendar, and I already knew there was several hospitals, and a guy in London or something like that. Sorry that I don't know all the UK names, but they had, I knew the dates of those review courses, and I was just going to fly over there. Obviously that was pre-pandemic, and I was going to do those courses. So that was my plan B.
You are not only expected to know Citrine, like even Citrine, I would say you're expected to know quite a lot of stuff. Different Citrine materials, either you're asking when you should use linol or Vicryls, what kind of Vicryls, what are the benefit or like pros and cons of different Citrine materials. And apart from a simple interactive suture, probably you should also understand how to use hand tie. Either it's a two-hand or one-hand tie. Apart from suturings, you should know other bedside procedures quite well. I am definitely sure you should learn how to place a chest string, not the simple Dept one, but the typical 28 French chest string, how you should do it, what you should remember to avoid, or like the specific surgical landmark to put on your chest string. And even you may be asked, well, what does the size mean? What does the French mean? So be prepared for all the different single details on all your procedure that you have managed to do. So not just inter the sutures, you are definitely asked beyond just simple suture. So learn how to for all your procedures. Even right now, when I doing my bedside teaching to my students from either Hong Kong U or CUHK, they know all of this quite well. So even the local students know all this information as well. You expect to know even more when you are in the licensure exam. So be prepared.
Yeah. So, I mean, wow, we're really getting a lot of questions. I'm so excited to help answer these. One thing is, just a brief aside about that. So when they say about suturing, you know, anybody that's already doing surgery, this is going to be second nature, but you got to scale it back a little bit. Think about, like, you know, not just hand hygiene, but for surgery, scrubbing in, putting some gloves on, the whole thing. No one wants to know just that you know how to suture. They also want to know that you're going to do it safely and approach that in the way that you normally do. But sometimes when we're stressed, you know, it's good to remember the full picture of what's being asked.
I noticed someone also asked about your dress code. So I think this is one uniform or the suit that I wear in the exam. Yeah, I think Marcus would as well, similar one. Yeah, I could tell you, please dress up decent. No t-shirt, no short sleeves or whatever random, and try to avoid any crazy fancy stuff. Yeah, this all definitely not in the exam as well. Just normal, like for guys, suit, tie will be definitely the basic for your exam. White coat plus minus, but just don't make your white coat tip like I am Dr. blah 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 from blah blah blah, like university or a different hospital. Some examiner will feel annoyed trying to say, oh yeah, I'm from which background. A plain white coat would be great enough. So in your exam, just to be decent, well present, be polite to your patients, and talk in a humble way. That is the basic manner we're expecting from the exam. For ladies, also as well, it's okay. Just the basic way. I think back in the day when I was in Australia, this is how I dress up when I was in Australia, Austin as well. So the way you do in Australia should be definitely good, well, even better.
Yeah, for ladies, I guess I'm the only one who can answer this. For ladies, no cleavages, and tie your hair back, not like this. And white coat, I didn't really wear a white coat, but that's because I'm not used to wearing, well, I wasn't used to wearing a white coat, so I didn't, and that was actually absolutely fine. So whatever you're comfortable with, guys, tie plus or minus. In Hong Kong, sometimes they do wear ties, but I know in other places like in the UK, they don't really like you wearing ties. So whatever you're comfortable with, really. But no jeans, as Raymond said.
Yeah. Remember one thing.
No, I was just gonna say I wore something similar. I wore a white shirt, and then I wore a suit, and I had a tie. And the exams like are over 2 weeks. You know, it's a span of 2 weeks. So I actually would dry clean my suit in between each of the exams. So I had my exam suit and tie, and that is what I wore for each of the 4 clinical exams, and I would just get it dry cleaned in between. So it was the same garment, the same look. It was the last thing I wanted. You know, sometimes they talk about like these tech billionaires and they wear like the hoodie and the same clothes. That's how I felt about the exam. I always wore the same, obviously clean, but you want to just not, it's like one less thing to think about. So that's how I approached it. And yeah, they do sometimes wear ties. So I felt very comfortable wearing a tie. I understand in the UK, that's not part of the exam look. Just do know that there's some variation regionally between Hong Kong and UK, Australia style.
And polish your shoes.
Yeah. Oh, one thing in practical exams, same in Australia, hand hygiene, please. Make sure you wash your hand in between, before and after your stations. You will definitely get a really harsh comment if you forget to do it. I remember I trained you well on doing this hand hygiene in all stations. Keep this habit in your practical exams, please.
Yeah, that's something that, you know, that was standard advice preceding the pandemic. Certainly now in the pandemic, it's always been important, but these are the reasons why it's important. So I think that that hasn't changed actually. The standard precautions would always apply. What Raymond mentioned earlier about you know, politeness and respect for the patient, those are universal values that we hold as physicians. And so I would recommend that don't let the heat and the stress of the exam moment, don't let that, you don't forget it, basically. Like, retain your values as a doctor, and just remember, train and practice for it. Sometimes it may seem silly when you say, oh, I'm going to do hand hygiene, or I'm going to ask the patient verbal consent, and you're saying this in a practice, but it's really important, because when you're stressed about the exam, if you haven't been practicing that, then your stress level is way high, and it's really easy to forget about some of these basics. So that's something that we always recommend for our people. There's the ONG and the surgery are the two that are formatted in the OSCE style. Those are the two that you have to study in that format for, and prepare for, and be used to that.
Supplement a little bit of the OSCE exam. Yes, I remember back in the day in Australia, regarding which rotations we have OSCE, but in pediatrics and medicines, it's a bit like a long case and short cases. And yes, in surgery, after your 5 minutes of examination, you get 1 minute of questioning time. And in Cantonese, it's more about the station type of work, so not much interactions with the examiner indeed. While for medicine and pediatrics, we do have quite a longer time of longer questions time from the examiner. Like for the long case, you're expected to make 40 minutes of patient interactions interview with a physical exam together. And then in the next 20 minutes, you get to present your case, also the problem, symptoms, and physical finding, a short list of problem list. And the examiner will go on asking questions for the remaining time for the 20 minutes. While in pediatrics, it's about like 20 minutes of patient interactions and 10 minutes questioning time from this examiner. It may take a little bit longer if you complete the history taking much earlier. While in the short cases, it really depends on your performance. Like if you exceed everything quick and fast in a shorter time, then the examiner will get a longer time to ask you questions, interact with you more. So it's more or less similar to Australia, but you expect to have a little bit longer time with the examiner on the questioning on what you found, what you think, apart from differential diagnosis, to ask for even the management plan. Not like what you are in the med school, you just talk about, oh, after this, I think I'm going to investigate with this, or just this, your differential diagnosis, how your management plan, or even if such a case, how you tailor-make the treatment method compared with the usual way. So it's a little bit different from the OSCE that I had in Australia. It's more challenging on the questions that you would receive from the examiner.